Hello, my name is Tiago and I'll be presenting this session about falls prevention policy and initiatives and a global perspective on older adult safety. And this will be an overview, very succinct due to the time, about this topic. It is important to talk about falls as it is one of the leading causes of injury and death among older adults worldwide. There are global efforts aiming to reduce falls through policy frameworks and initiative programs, and this presentation will explore best practice, case studies, and some recommendations for falls prevention. We know that falls among older adults, the prevalence is approximately 30% of older adults globally experience at least one fall annually. 15% fall multiple times within a year. All these statistics are present in one of my articles that you will see in the reference in the end of the presentation. The population at risk, the UK population includes approximately 12 million adults aged 65 or older, and this picture is very likely being worldwide. We know that falls are the leading cause of injury-related hospitalizations among older adults. 5 to 10% of falls result in serious injuries such as fractures or head trauma, and psychological effects include increased fear of falling, which affects 60 to 85% of older individuals in the community, and the fear of falling correlates with reduced mobility, social isolation, and anxiety depression. We also know the impact economic this will have due to hospitalizations and long-term care needs. And older adults who fall often experience functional decline, reduced independence, and a diminished quality of life. We can divide the risk factors in 7 main domains: the balance and mobility, age-related physical decline, environmental hazards, medical conditions, pharmacological factors, psychological, the fear of falling, for example, sensory and neuromuscular, and sociodemographic factors, for example, gender, frailty, and living situations. Now, in a very succinct way, we will explore successful initiatives around the world. For example, the community-based interventions, for example, Tai Chi or Qigong in China. Tai Chi is a traditional Chinese martial art, has been widely adopted as a community-based intervention aimed at improving physical health and mental well-being, particularly among older adults. Studies indicate that participation in Tai Chi classes can significantly enhance balance, flexibility, and strength, thereby reducing the risk of falls among elderly population. Furthermore, the social aspect of Tai Chi fosters community engagement and support, which is crucial for mental health. The integration of Tai Chi into community health programs has been recognized as a valuable approach to promote active aging and improve health outcomes. Other programs: the physical activity promotion fall-proof programs in Australia. We have these fall-proof programs in Australia have been implemented to promote physical activity among older adults, focusing on strength and balance training to prevent falls. These programs have shown significant success in reducing falls rates and enhancing participants' confidence in their physical activities. Evidence suggests that structured physical activity interventions, such as those offered in fall-proof programs, lead to improved physical function and a decrease in incidence of falls. The Australian government has supported these initiatives through funding and policy frameworks that emphasize the importance of physical activity for older adults. On Europe, we have this case in Sweden of home modification service. Sweden has implemented government-funded retrofitting service aimed at modifying homes to enhance accessibility and safety for older adults and individuals with disabilities. This service includes the installation of grab bars, ramps, and other modifications that facilitate independent living, or for example, the age in place. Another article that I did write of that highlights the importance of the older populations aging at home. And research indicates that such home modifications not only improve safety, but also significantly enhance the quality of life for residents by enabling them to remain in their homes longer and safer. Swedish model of home modification service serves as a benchmark for other countries, demonstrating the effectiveness of government intervention in promoting health and well-being through governmental adaptations. Another case studies and policy frameworks. We have these three: the review of UK National Falls Prevention Guidelines, which is important as a public health concern, prompting various programs. For example, the UK National Institute of Health and Care Excellence, NICE, has established comprehensive guidelines for prevention of falls among older adults, and these guidelines emphasize the multifactorial approach, which includes assessing individual risk factors, implementing tailored interventions, and promoting physical activity. The guidelines advocate for the identification of older adults at risk of falls through systematic screening, providing interventions such as strength, balance training, home modifications, medication reviews, etc. And the New Zealand ACC program is being noticeable due to the reduction of fall 15% and have a comprehensive coverage of injury prevention and rehabilitation and evidence-based strategies promoting physical activity, environment modifications, and it is being successful. The analysis of healthcare cost reduction in pilot initiatives is with the study that actually the government that invests on these programs normally in the long run can save money and have a better quality of life of their own citizens. So, practical recommendation in a nutshell: policymakers develop integrated national strategies for falls prevention. It is important that healthcare professionals promote evidence-based interventions like balance training, and for the community leaders encourage active participation in local programs. As a conclusion, falls prevention requires a coordinated global approach. Sharing best practice and adopting proven framework can significantly reduce falls, and together we can improve safety and quality of life for older adults worldwide. This is the reference. Thank you so much for listening. It's been a pleasure. Thank you. Bye-bye. Thank you. These are my details. Any queries or any comments, please feel free to contact me on my email or my ResearchGate profile. Thank you.